thanks so much for joining us this afternoon. I'm Donna McMullen, your host for Baxter Regional Medical Center's Healthy Connection, and our lovely guest today is Miss Sherry McGoldrick, and we'll see if I can come close to getting it correct. You are CIC, which is Certified Infection Control. All right. She's our infection control person, our go-to person at Baxter Regional Medical Center. So, Sherry, welcome. We're awfully glad you're here.
Thank you, Donna, for having me.
Oh, I'm glad that you're here. And we get the opportunity to talk to folks. Our goal is always to educate the public about how they can stay healthy. And one of the ways that they can stay healthy this time of year is to do what?
Wash your hands.
Wash your hands.
And that's about all year round, but especially right now.
Yeah. Is there a time frame? I've heard different things from different people, so now we go to the absolute source, the expert. I've been told you should sing happy birthday when you wash your hands. What's a good time? Amount of time.
CDC guidelines for a good hand washing is 15 seconds. 15 to 20 seconds.
Okay.
And at the hospital, in orientation, we try to teach them to do the Yankee Doodle song.
Yankee Doodle. Okay.
And some people do the happy birthday song. But I'm fortunate every year to be able to go to the kindergarten and try to help them learn how to wash their hands.
Okay.
But it's more of a learning process for me because they teach me the ABC song every year. And they're very, the teachers do such a great job with cough etiquette with the kindergarten class. We ask questions, where do you, how do you cover when you cough and everything, and they put those little arms up and they'll cover them, or they'll pull their shirt out and they'll cough down there, and I try to get them to tell me that I can wash my hands with just water and get by with that, and that doesn't go well, Donna.
It doesn't go well.
No,
Okay.
You have to have soap and water, and we do the ABC song.
Oh, how wonderful. I think that's some of the things that people don't always realize with Baxter Regional Medical Center, that as a hospital, we go out to the communities, all 14 counties that we serve, and we offer different programs to try and all ages on how to avoid getting becoming ill, and how to stay healthy. So you're out there with the kindergartners.
I do
teaching them how to.
They're teaching me most of the time.
And you learn your ABCs.
Every year I learn my new ABCs every year, yeah. So they're great. And then I've also went out into the public in OSHA, which is part of the government that regulates safety regulations, and one of those is bloodborne pathogens.
Okay.
And of course that's one thing that we follow at the hospital, but a lot of the organizations and different companies here in town, they also have to have that education on bloodborne pathogens. So I've been fortunate to be asked by several of the different places here in Mountain Home and in Yellville and Flippin, and to go in there and give them that education also.
Okay, so this is all about if someone has a cut and there's...
Yes, it's viruses, the HIV and the hepatitis virus, and how to prevent that transmission if they were to encounter anybody's blood.
Okay, so they're getting good education while at the job place, as well as different literature I know that we have available for them as well. One of the things too that I know you were instrumental in, and I see them in so many places, not only businesses but in churches. I know that you did a huge campaign last couple of years when we were so concerned about the H1N1 influenza. Am I saying that correctly?
Correctly,
okay.
Yes.
And that had that come to our area in en masse and in affect huge numbers of folks, one of the things that I see are the antibacterial soap dispensers.
Yes.
Churches, grocery stores, of course in the hospital.
Yes.
And I know you'd probably want to encourage people that are listening
to use them.
And if we can get them into even more places, it would be wonderful. So.
And not only the alcohol hand foam, but like some of our larger grocery stores and Walmarts, they have the hand wipes for the handrails on the carts.
On the carts when you come in.
To wipe those off. I highly recommend to use those also. And, it's been brought up, about, different people using that, and then you touch something and you probably get bacteria from that too. That wipe will stay on there for a period of time anyhow. But the other thing is that a lot of times the carts have children in them, okay? And children harbor about everything that comes along, they get it, okay? So it's just a little added precaution to use the wipes and wipe that handle off.
I know, since you and I have talked, I make sure the minute I walk into a grocery store, I'm looking around for where is that sheet to wipe off that bar.
Yes.
Yeah, and it really has worked. I mean, it's certainly cut down on any colds, or haven't had the flu in years.
And then, last year, like you said, with the H1N1, and we were very fortunate. We had a few serious ones, but didn't have the amount that they were concerned about us having. But I think the churches and the stores, that they stepped up to the plate and put those alcohol hand foams out there for that people can do that little added protection to get those unwanted bacteria and viruses off your hands. Yeah. You have two types of really bacteria that you have to deal with. You have what are called your residential bacteria. They're yours. Everybody has them. Staph is a normal bacteria of the skin and found in the upper airway. Everybody has staph. But then you have what is called the transit bacteria and viruses, and those belong to somebody else. I call them hitchhikers. I think of things very simple, okay? And you get the hitchhikers on the hands, and primarily that's what those alcohol hand foams are doing. They're getting rid of those hitchhikers or those transit bacteria that belong to somebody else that you've picked up on your hands. We probably touch our face, our eyes, our nose, our mouth. I think the last study that I read was probably about 10 times an hour.
Yeah, so without even realizing it.
Subconsciously we do it. So that's the major way of the viruses like influenza or your colds are spread to you, is you do it yourself with your hands.
I know I'm tempted more and more with the hospital, with the folks that are coming to us that are very sick, that are very ill, and various pneumonias and flus and this kind of thing, and not only on doorknobs, bars that open doors, but I'm finding on elevators, I'm using my elbow.
Yes, yes.
Anything to not have direct contact where a lot of the public will.
Well, the administration at the hospital has been very aggressive. I'm very thankful to them for that. But we have the alcohol hand foam at every one of our entrances into the facility, as well as into every one of our units. We have the hand foam inside of every one of our patient rooms. Now, CDC, which is the Center for Disease Control, has guidelines for the healthcare facility for healthcare providers. And if your hands, of course, come into contact with any type of contaminant, you have to use soap and water. But on a whole, then they say we can use the alcohol hand gel to help get rid of those hitchhikers.
How about with gloves? When I know with our nurses that when they come into the room, they clean their hands. I think I have the correct order on this. They have to clean their hands, and then oftentimes will then put on rubber gloves, and then take those gloves off and dispose of them before they ever leave the room, so that there are no hitchhikers going to the next patient. And they go in.
And they're supposed to, whenever they pull those gloves off, one of the things with the healthcare providers that we've been trained, of course, we have to use our gloves. And I feel, as infection control coordinator at Baxter Regional, that if I can protect the employees, I protect our patients, okay? So if we have to wash before we put our gloves on, and then whatever that we're doing, after we've got done, we need to pull those gloves off, and we need to either alcohol foam or wash our hands again. Right, because if we don't do that process, there's a chance of taking it into the next patient, and we don't want to do that.
We don't want to do that.
No, we don't.
Well, Miss Sherry, hang on just a moment. Okay. We're going to take a short break. We'll be right back. Don't go away. We want to learn some more on how to keep you healthy and how to get you through this winter, this cold and flu season, hopefully, without spreading it and perhaps even not even contracting it. So we'll be right back.